Great British Debate this hour. And I'm asking, should people who can afford private healthcare stop using the NHS? This comes from as Labour warn that our National Health Service is leaving increasing numbers of patients being forced to choose between waiting longer in pain or paying to go private in what they brand as a Tory two-tier healthcare system, with waiting lists reaching record levels. So for the Great British Debate this hour, I'm asking, should people who can afford private healthcare pay for it? I'm joined now by political commentator Peter Spence, NHS GP Dr David Lloyd, and political commentator Stephen Carlton-Woods, and NHS doctor Dr Basha Mukherjee. I hope I've said that right. All right, Peter Spence, political commentator. Surely Keir Starmer said that he would absolutely use the NHS, but isn't he just clogging up the waiting lists?
I mean, first off, I would say in answer to your question that Nye Bevin, if he could hear this conversation, would be turning in his grave when you think that the idea was free for everyone at the point of delivery. Well, there's such a huge problem now about that point of delivery. It becomes very, very elusive indeed.
Although, Peter, at the time he said it, the population was a lot smaller per capita, wasn't it? So he said it in a time when, it was a lot smaller. There were, so...
Yes, I understand all that, of course. I'm just making sort of the general point. But when it comes to the specifics, Keir Starmer has said no, he would not use private treatment, partly because of the fact that, his mum was working in the NHS and so on. But his shadow health secretary, Wes Streeting, says, yes, he would use it if he needed to. And it's a question really of whether you're actually shortening NHS queues by going privately or indeed jumping them. And it is a very balanced and a very nuanced argument. I mean, frankly, if I needed a treatment, didn't seem to be able to get it in the NHS, I would go for it. But looking slightly further ahead at the prospects for the NHS, what is needed clearly is root and branch reform and shed loads of money. Now, the money thing was needed...
Or perhaps saving money, because there's a lot of there's lots of management up the top there, net zero managers and all that, which I'm sure we could quite easily dispatch of. Well, listen, Peter, I'm going to move on to Dr David Lloyd, but I will come back to you. Dr David Lloyd, should people who can afford to pay for private health cover sort of get off the waiting list and get on with their treatment and let somebody else take their place?
Golly, it's such a difficult question you've asked. I either know too little about this problem or too much. What I can say is that last year, the NHS spent £15 billion on private healthcare, and the 7 million people who use private healthcare spent 11 billion. So the NHS is actually the largest purchaser of private healthcare. Your previous speaker mentioned Nye Bevin, and famously he also said that he stuffed the consultants' mouths with gold to enable the NHS to start. And so NHS consultants have always been able to work in the private sector since the very start. And then what Barbara Castle did then in the 70s, that she shut down the private wings of hospitals where you could get private treatment in your local hospital, and that money would be fed back into the NHS. And that's what kick-started this enormous private market that we've got at the moment, which is mainly being taken over by the big players in America. So the money the profits from private healthcare at the moment are leaving this country and going straight back to the USA. So I would argue for opening up private wings in NHS hospitals, and that money can be fed back into the NHS, and we would stop the price gouging that's going on at the moment in the private healthcare sector, who've put their prices up enormously because of COVID and the demand. So the system doesn't work at the moment, but perhaps we could make it better with a private system, but involve it with the NHS.
It begs the question as to why, because I remember when they used to have private rooms within the NHS hospitals, it wasn't that long ago, and suddenly they weren't doing that. And it begs the question as to, it seems that a lot of people will take the NHS, but they could actually pay for it, so perhaps they should. Dr Basha Mukherjee.
We're all talking about the money aspects, and we're not remembering what it is like for the patients at the moment. And I see patients all the time, and as a GP trainee myself, it is so sad for me to have to tell them that they have to wait 18 months to see a specialist. And actually, it's heartbreaking to be in the position of the patients having to choose when they're already paying their taxes and yet they have to wait. And when they are finally being seen, they're not very happy with the treatment they're getting in the NHS. A lot of them only are getting telephone appointments. Cardiology appointments are being done over the telephone, and they're not even setting their eyes on the patients and making decisions and recommendations based on this. So it could be argued that the NHS is not what it used to be anymore. And actually, sometimes the patients just want a bit of reassurance from someone, and that they might not get that for months and months and months. I actually do see patients who, a lot of them who are choosing to go abroad to get their treatments done. Maybe they're originally from a different country, and it's much cheaper to access private healthcare in those countries. And it's much cheaper to travel there, get their treatment, come back, and essentially free up space for NHS users. So I think actually, my role as a GP is to signpost the patients and tell them the real truth, manage their expectations. And I'm having to tell them the bitter truth at the moment that they'll be waiting a long time. Have they considered private? Have they considered looking into options abroad if their price point is not being, achievable locally?
Yeah. Well, Stephen Cotton-Woods, Keir Starmer said that he wouldn't use private healthcare. Do you think he should, though, seeing as he can clearly afford to pay to go private? He's definitely not short of a bob or two. Won't he help to clear the backlog by doing that?
Well, I don't believe him when he said that, actually. But,
I didn't either.
No. I mean, anyone in the right mind, if you can afford it and you need it, or you need to help a member of family, you would do whatever it takes to get them that treatment. So to say that he wouldn't pay for them to have life-saving treatment, I don't believe it, really.
You don't believe him? Yeah, I struggled to believe it as well, but he doubled down on it and he's gone and repeated it again. But do you think then, ultimately, though, if people can afford it, Stephen, they should really pay for it? Because it would probably help.
No, I think that's the wrong question, really.
Oh, really? What is the question? What should I be asking?
Well, first of all, I think the NHS now is not fit for purpose. And everyone on this panel here has highlighted different reasons why it's not fit for purpose. It needs to be overhauled. Now, the Conservative government are terrified of overhauling it because they get accused of privatising it. But when Labour do it, it's called outsourcing, and that's sort of accepted. But people need to get together, stop playing political football with it, and really sort out the NHS and make it an accessible service for everyone. And if people can afford to go privately, that's another issue completely.
I didn't want to ask that question, though, Steve. That's why I didn't ask it, you see. I could have asked that question, but I chose not to, because I think there's a consensus of opinion that it needs reform. I think we all of us would agree that it needs reform. So there's no point asking that question, because we all know it. So I asked... But what about... OK, so there are the Netherlands. I think they have a sort of like a... I think it was Nigel Farage who mentioned the Netherlands, the different structure that they have, where you can pay and then you get a rebate in your taxes. I think does that not sound like a good idea? I'll go to you, Peter Spencer. Does that not sound like a good idea to you? Two-tier system, there's nothing wrong with that.
It's a potential runner, and when I talked about reform earlier, I meant right across the entire spectrum. And I know that back in the day, Tony Blair also deliberately, as you use the word outsourced, he deliberately brought in the private sector to ease pressure on the NHS, and indeed Sir Keir Starmer, if he becomes the next Prime Minister, is likely to do the same, although I do have to come back to it. What it also needs is shed loads of money. It was easy enough.
No more money.
Listen on.
Briefly, you've got 10 seconds. I'm going to have to end it there in a minute.
There is no more money. That's the problem.
No, they don't need any more money. I don't think I can hear this anymore. They get
you don't
billions.
Think they need more money?
Listen, they're spending it badly. If I give you a load of money and you're bad at spending it, you'll spend it. It's almost like an addict given money and will just go and buy anything at ridiculous prices. So, but that's another question. That'll be a question I will be asking another time. But briefly then, so do you think that people, Peter Spencer, yes or no, should people, if they can afford to go private, pay for it?
Yeah, of course.
Yeah, Dr. David Lloyd, should they pay for it?
Only if it's provided by the NHS.
OK. Stephen Cotton-Woods.
If they got a rebate off the national insurance contribution.
I would agree with that. And Dr. Basha Mukherjee.
I think the NHS there should be a small charge for that as well, because we're in this problem because of the misuse of the NHS.